a hot topic right now along with some skincare trends making their rounds on social media. And joining us this morning to talk to us more about this is Dr. Stephen Greene from Advanced Dermatology and Laser Institute of Seattle. Thank you so much for being here with us today, Dr. Greene.
My pleasure.
Okay, so it is the middle of summer. We've had some really hot days. We know we need to protect our skin. What is the safest kind of sunscreen that you can use on your face?
Sure. So the current guidelines include a higher SPF than in years past. So 15 years ago, the SPF rating was 30. We're now recommending a sunscreen that has a rating of 40, 50, and 60.
Oh, wow.
We want to be very cognizant of whether patients are acne prone or if they have dry skin. And that is oftentimes a great segue into making recommendations on the best sunscreen for patients.
So does it matter what type of skin tone you have, whether it's dark or light, or what type of sunscreen you're using? Like, do you recommend a mineral over maybe something else? Does that matter?
Yeah, so these are great questions. So chemical sunscreens provide deep protection, whereas physical sunscreens are products that provide some absorption of heat as well as reflection of the sun-damaging rays. If a patient is a darker skin tone, we're going to be wanting to recommend a product that is cosmetically elegant, that will increase and encourage patients to want to use the product. Mm-hmm. So today I did bring some products that would be useful to use to illustrate some of these points.
Okay, yeah, and that's really important. So when you talk about putting like a product on in the morning with your skincare routine, or maybe your makeup that you put on in the morning before you go to work, how long is that SPF going to carry you throughout the day? Like, could you go on a walk at your lunch break or after work and not have to reapply?
So usually sunscreens last about 2 to 3 hours and require a reapplication. The products are influenced by just our hands touching our skin, by clothing that might rub on those important areas needing protection. So reapplication during the day is vital if we're going to be out in hot, direct sun.
Okay, and then with apps like TikTok, we are seeing retinol, tretinoin kind of trending on those apps, and I know that can make your skin more sensitive to the sun. How important is it to really double down on that sunscreen if you're using anti-aging skincare like that?
Yeah, that's a really important central topic. The retinoid class of skincare, tretinoin, retinol, they are important as anti-aging and anti-cancer products, as well as treating acne. And we recommend that these products be applied at nighttime to lessen the issues of sun sensitivity. Okay,
that's good to know. If you do get a burn on your face, what's the best way to nourish it, or I guess kind of help? Can you ease the damage on your skin if you do get a sunburn on your face?
Yeah, so the more sunburns you get, the greater the risk of skin cancer down the road. Mm-hmm. So it is vital to repair the skin, I think, in terms of both defense and repair when we're wanting to protect the skin from sunburn. There are products, for example, Lumavive, which is a product made by SkinMedica, which has a morning defense ingredient and then a nighttime repair system apart. We also have sprays that include green tea and antioxidants and humectants that attract water to the skin to reduce puffiness and redness. And also you can take non-steroidal anti-inflammatory drugs by mouth, such as ibuprofen, Aleve, or aspirin, that will break the inflammatory cascade of events immediately. So that's also very helpful to know at the time of a sunburn.
I've never heard about that. Okay, so keeping with social media trends, there's this big thing on TikTok right now, skin flooding, where you try to flood your skin with as much hydration, starting at the face wash and then, serums, oils, moisturizers. Is that good for our skin, or are we just kind of wasting product?
So this is a great question. This used to be called skin slugging. So skin slugging was the original term where very occlusive products would be applied to the skin to try to superhydrate. It became clear after some time that people who were especially acne prone were getting flares of acne. So the idea of skin flooding is actually a more strategic approach where you actually apply skin actives to the skin.
Okay.
Both to reduce risk of acne, to reduce the signs of redness and puffiness and even pigmentary changes, and then seal it in or sandwich it in with a good moisturizer that does the job seriously but is not so occlusive that it will cause acne. So this is always the sort of yin-yang.
Yeah.
We're trying to seal in water to provide a moisturizer, but there's always the risk of causing acne, which is the cause for lots of work for Dr. Greene.
Yeah, lots of work for Dr. Greene. Yes. Well, thank you so much for coming on and sharing some of your expertise with us. Dr. Stephen Greene with Advanced Dermatology and Laser Institute. I'm sure if anybody has any questions after this, they can reach out to your office.
Absolutely.
All right.
Welcome any questions.
Great. Thank you.